So I want my brow bone to be a bit flatter, especially here. I think it's quite dominant.
In this area, yes, it's
Yeah.
very dominant.
Yeah. And then not a cat eye, but like just a little.
Okay, your tail of your eyebrow.
Yeah.
You want this area more elevated.
Yeah, is it called temporal?
Temporal lift,
Yeah.
yes.
Maybe a slight cat eye, but not too much.
Okay. And mid facelifting. Do you want this area to be lifted?
I want this area to be lifted, but I'm not sure if I'm too young for that now.
Yes, you're young, but we can do liposuction and J plasma for your skin tightening, liposuction for your jaw area, and also for your neck, because you also have some skin excess in that part, especially when you do this.
Yeah.
So since your age is really very young, without any scar, we can tighten the skin in that area. And this area will be smaller as well.
Okay.
And this shape of your V shape of your face will be more visible.
Okay, but not a buccal fat remover. Or
You
is
want it?
No.
Oh, I won't do it.
Okay.
We will be carrying your fat tissue up actually. This will also help skin excess in here. It will be less.
Okay.
And with aging, all these fat pads are going down.
Yeah.
Now your nasolabials are starting to be more visible. Especially I can see difference in that part.
Okay.
The fat pads are separated. So when I do this, your lower eyelid area will be much better. And your desired effect about not cat eyes, but more slant eyes.
Yeah, lifted.
It will be
a little
better.
bit, but more so like here.
Yeah, exactly. But when we do this, you have a very deep groove here. So I will do a little bit aggressive brow bone shaving in that part.
Yeah.
So this area will be much more fresh, and it will be much flatter. So we will have much better results in that area.
Yeah.
You won't need upper eyelid blepharoplasty or fat injection to that area. So our results will be much better.
What, fat in this area?
Yes, it will be actually, if you do this, you have a groove here. It's called A-frame deformity. It's not very visible, but with aging, with loss of fat tissue, this area will be deeper. Maybe you saw around here. And this area doesn't look very good, but when we do this bone shaving, this area becomes flatter, and your results will be much better.
Okay.
Okay.
And then a lip lift. I wanted a lip lift.
Okay.
Because I've got a filler, but I want to get the filler out afterwards. So I just want my natural lip
You
to
also
be.
have a little bit asymmetry. Your left side is higher than your right side.
It's probably the filler.
Yeah. But if you ask me, it's not so long. I will do a slight elevation. I will mostly invert your lips.
Yeah, if you can lift it as much as you can, because there's a lot of filler.
Okay.
And I want to get that out, so then I'm just left with it. Because I've got my natural lips are really small.
Okay, I will be doing inverting your lips actually, so they will be more visible, and I will make a natural lip actually.
Okay.
It won't be very aggressive. Okay, there is no return back from it.
Okay. And the scar revision here.
Okay, we did a revision for your Endoscopic shaving, and you had a little bit keloids. We will do a double plastic for here.
Yeah.
Okay. This is our midline, our incision. Eventually, we will try to preserve all of them.
So where will the scar be?
Scars will be here. They will be about 3 centimeters long.
Is it in the hairline?
Yes, I will try to keep it as much as in hairline. Actually, your hairline is a little bit high, but I will do the operation from inside your hairline.
Yeah.
When you cover your hair, they won't be visible. I will be lifting that part of your eyebrow. So when we do this, there's also a slight asymmetry. Your left side is a little bit down. We will make it as symmetrical as possible. We will do our best. And we will be shaving your brow bone around here. So our lifting will be more visible around. I will be also doing a mid-face lifting. I will lift all of your tissues from here. So in long term, you won't be needing facelifting.
So where will that scar be? Is it the same?
Yeah, same scar. There will be no extra scar.
Okay.
I will also, you also have slight discolorization under your eyes. I will rearrange your lower eye fat pads.
Okay.
And there will be no extra scar for it, don't worry, and it won't affect your eyelids.
Okay. Is that the fat transfer?
I will rearrange your fats.
Okay.
Okay. There will be no extra scar. And we will be making our lip lift. I will be mainly everting your lips. So need of your fillers. Less, and we will no fillers. I will be doing a liposuction to that part. And J plasma for your skin, as we did in Melle. In young patients, it gives very nice results. It's really very early, and your scar healing, as we seen here, doesn't heal very well. If you do facelift in young age, there's risk of keloids. And keloids around here doesn't very well.
Yeah.
And we will be doing a scar revision for that scar. I will be doing a doubleplasty, double V-plasty. So it will be a little vague at first, but it distributes tension and it heals very well. So we will be doing on mid-face lifting. So only visible incision for all this thing will be here, inside your hairline.
Yeah.
And your hair will be covering that area very well. It will be around 3 centimeters long. I will try to preserve as much as grafts of your hair transplantation.
Please,
and yes, we will be lifting that area, and I will be doing shaving for that areas as well.
Yeah. Is there anything that needs to be shaved here, or is it?
If you ask me, no.
Okay.
Because this concave looks very nice and feminine. Don't worry, you don't need any of them, and I will be doing liposuction for that areas, that area. It will be enough. You don't need buccal fat removal.
Yeah.
In case if we do, you can have very shallow cheeks.
Yeah, I don't want shallow cheeks. Yes. I just want this to go.
Yes, but at first, with mid-face lifting, this area will be full too much. Don't be scared. About 1 month, it will be very natural, and your nasolabial area will be less.
Yeah.
You have shallowness, especially around here.
Okay.
This area looks good. Do you have filler in that area?
No.
There is a slight asymmetry also in there. Maybe I can put little fat to here.
Yeah.
If needed.
Okay.
In the end of operation, I will decide it.
Okay.
And for your liplet, we will be using a bullhorn technique. And I will be everting your mucosa, so your lip will look much bigger than before.
And is there going to be a scar here then?
Yes, but I always hide the scar inside your nose.
Right, yeah.
So it's not so very different from normal rhinoplasty operation actually. Okay. It will be like this. Our total operation will be around 2.5, maybe 3 hours.
Okay.
Swelling will be too much because of this all bone shaving thing. But at first it will be very swollen, and around 1 month most of the swellings will be gone, and in 3 months we will see very nice results. Okay.
Yay.
Any questions for me?
No, that's it.
Okay, see you then in operation room.
Yeah, see you soon.
See you.
Bye.
Bye.
With the FFS surgeries, we mainly use endoscopic treatments. That means that we are using minimal scars in the face. It will be hidden in the hairline. With the patients who has a high forehead, the scarring can be visible. With the endoscopic surgeries, we can do forehead lift, brow bone lift, brow bone reduction, mid-face lift, the scarring will be minimal. Dr. Turgut Kayadibi makes first, he will start with the top of the head and then he will go down. In the beginning, he did with the endoscopy, the brown bone shaving. With the help of the endoscopy and a small camera, he will see which part of the bone he needs to shave to make the brown bone smaller. After that, he's making in the same incision, he's making the mid facelift, and then he will start with the brow lift or the temple lift. The mid facelift surgery is suitable for patients who have sagging tissues at the cheeks. It's suitable for patients with mid-20s till mid-30s. Of course, it's depending how much amount of the tissue is sagging. If the patient has an extensive weight loss, they mostly will have skin excess. So there is a possibility for a mid facelift, but sometimes the surgeon is also choosing for a facelift with excessive weight loss patients. The mid facelift surgery prevents the tiredness, sagging, tired look. Also with the mid facelift, the under eyelid tissue will be reorganized to give a more fresher, bright look.
Okay, we did brow bone shaving, as you can see from here, and according to here, you can see this bulge. There is no bulge. These areas smoother. Of course, these are more swollen now because of surgery. We also did mid facelifting. You can see this nasolabial sulcus is not so deep. And these areas lifted. These are a little bit overcorrection now. This area will be smoother. Also, lower eyelids area is more better in that part. There is no sulcus here. And as you can see, also this lip is also elevated a little bit. We also fixed her eyebrow. You can see if you now look while laying down, there is not so much difference, but when she stands up, this area tends to go down, but this area won't go down, and this area will stay as she tied her hair very tight, and this will keep this situation for a very long time, and she won't have wrinkles around that area, and this area will be smooth. Also, this mid facelifting lifted her eye a little bit, not as much as cat eye surgery, but this will be relaxed and it will go down a little bit since we didn't put any stitch in that area. Today you can take shower, but use baby shampoo. It's important. Yes. Now I will put spray for easy removal. You only have 2 incisions from it. Your swellings are less than Ella's. It's yours. Not so much swelling. 2 weeks later, you will be restaurant ready. You won't want to remember this. For 3 days, this swelling is very good. This is the maximal swelling actually.
Okay.
After 3 days, day by day, gradually it will go down. You are very swollen. Your lips are also extremely swollen because of also old fillers. Yeah, your hair very swollen. We did a very aggressive bone shaving around that area. It also makes bone edema. But your lip lift looks very nice. We also did fat injection to that area, and you also had J plasma. J plasma gives a helium gas inside, so your eyelids are mostly swollen because of this.
So I want you to make this massage
Yeah.
every day. Whenever you remember, you can do this.
Yeah.
So your swellings will go down faster.
Up.
Yes, up. And for here, lateral.
Okay.
Yeah,
Like
exactly.
lymphatic drainage.
Yes,
Yeah.
exactly. Since we did liposuction to that area, we nearly get 40 cc's of fat. It's a good amount for this area. And I gave about 20 cc's back to your cheeks. So it will also make your skin much better and nice.
Yeah.
Okay, you can check if you want in the mirror.
Nervous. Oh my god.
Extremely swollen, but your chin also looks very nice. When your skin gets tightened with the effect of gel plasma,
Yeah.
everything will be much defined. Your especially jawline,
Yeah.
your cheeks, and your forehead will be very good.
Yeah.
Now we will watch for healing. Yes, come here please. Now we won't put new tapes on your face. It's enough. But every day, please clean your scar with the solution that we gave and the Q-tip.
Yeah.
There shouldn't be blood clot on it. It's very nice now.
Okay.
You don't have any blood clots. So keep it well clean and protect it from sunlight.
And do we clean these?
Yes, there are no strips here.
No, this one.
This one. Oh, okay. It looks very nice.
Okay.
You can just start to use anti-scar cream about 1 month later.
Okay.
For this area and for this area. And for both scars, you should use sunscreen cream in daytime. These sticks are absorbable. They will fall on their own while you are having shower. Most probably, most of them will be gone. And in about 2-3 weeks, there is no evidence of it. You don't need to clean them. Just use baby shampoo. You can take shower. Otherwise, that's it. Okay.
Thank you.
You're welcome.
Thank you so much.
We will be waiting for your healing photos.
Yes, I'll send them.